Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar. New undergraduate curriculum introduces students to Alzheimer's and dementia, a rapidly growing public health issue. Today's webinar will be 1 hour in length, which will include a question and answer period after the presentations. This webinar is part of the 2016 ASPPH Presents Monthly Series, which has been designed as a service to CEPH-accredited ASPPH member schools and programs of public health. The webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note: while you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. I'm pleased to introduce today's speakers. Molly French, who is the Director of Public Health for the Alzheimer's Association, manages the organization's public health policy work. In this role, she works closely with state and national public health organizations. Previously, she consulted with national nonprofits on population health issues, directed policy research for Partnership for Prevention, and advanced health policy in California. Tara Red is a Program Development Director with the Emory Centers for Training and Technical Assistance at Emory University. She is a co-leader of the Alzheimer's Curriculum Project. In addition to her work in the field of aging and Alzheimer's, Tara is interested in increasing the awareness and knowledge of the public health workforce to better address this devastating disease that has impacted several members of her family. Dr. Cheryl J has been a faculty member in the Clemson University Department of Public Health Sciences for 25 years. Her most recent research and education efforts focus on promoting brain health, improving quality of life of those with dementia, and reducing stress of family caregivers of those with dementia. Dr. J has led efforts to establish the Clemson University Institute for Engaged Aging and the Senior Smart Center of Research and Economic Excellence for South Carolina. And Jean Marie Place is an assistant professor of health promotion and education at Ball State University in Muncie, Indiana. She contributes to research in women's health and maternal mental health. Thank you all for being here today. I will now turn it over to Molly.
Hi everyone. Thank you so much for being on the webinar today, and especially a big shout out and thank you to Sarah and the ASPPH. They've been terrific partners for us in the development of this curriculum. I also want to thank my co-presenters, especially Dr. Place and Dr. Dye, for providing us with a faculty perspective, which is just so valuable. And I certainly want to acknowledge the Centers for Disease Control and Prevention for their support for the curriculum project. And here I am. Oops, excuse me. And now I got my clicking going. I wanted just to recap our objectives for today for you. We'd like to equip you to be able to recall a couple of facts about Alzheimer's and other dementias as a key public health issue, enable you to describe or know about some of the important features of the curriculum, and then be able to give at least an example or be able to recall an example of how the other teaching faculty have used the curriculum with their undergraduate students. I'm going to first quickly touch base about why Alzheimer's is in fact a public health issue. And this is our trajectory chart. And since Alzheimer's and other dementias were included in Healthy People 2020, we've seen increasing recognition in the public health community of Alzheimer's as a public health issue, especially in the last 2 to 3 years. And this trajectory chart is one key reason why Alzheimer's is starting to be seen as a public health issue. First, the burden is large. Currently, over 5 million Americans are living with the disease. It's the 6th leading cause of death, and it's also one of our most expensive diseases in the U.S. The burden, as you can see, is growing. Age is one of the primary risk factors for Alzheimer's and other dementias, and so with the aging of the baby boom generation, the number of people aged 65 and older with Alzheimer's is on track to triple. That is triple from 5 million in 2013 to nearly 14 million in 2050. And the cost for caring for these individuals is expected to increase in lockstep as the numbers grow. In 2014, caring for people with Alzheimer's and other dementias cost nearly $200 billion, of which $150 billion was paid for by Medicare and Medicaid. In 2015, the costs are expected to top $1.2 trillion, and that's in 2050, but in current dollars. So again, it's a very, very expensive disease. But Alzheimer's, like other health conditions, there are opportunities to make a difference, particularly for public health. Historically, Alzheimer's has been seen as primarily an aging issue, but I do want to be clear that Alzheimer's disease is a disease. It's a neurodegenerative condition, and thus a health issue. And like many other diseases, Alzheimer's and other dementias have established risk factors that are modifiable, and like other diseases, early detection and diagnosis can improve outcomes for both people living with the disease and our communities. Because of the growing burden, we really need to have a robust public health response. But what we're finding is that public health professionals just are not prepared to address this epidemic, such as in terms of understanding the disease and its impact in public health terms, raising awareness among professionals as well as the public, and especially devising effective and utilizing effective interventions to support families and individuals. So kind of given the situation, how are we going to prepare a public health workforce to address this growing epidemic? Currently, very few public health courses discuss Alzheimer's, and we are working to change that, actively working to change that, and we hope to engage your support and the help of your fellow colleagues who are teaching undergraduate students. So now that you know a little bit about why Alzheimer's is a public health issue, I wanted to give you a broader context for our efforts to mobilize a public health response at all levels. Back in 2005, the Alzheimer's Association came together with the Centers for Disease Control and Prevention, and we formed the Healthy Brain Initiative. And the goals of this initiative are to promote knowledge and awareness and action by the public health community on cognitive functioning and cognitive impairment, including Alzheimer's disease. And this was done in recognition that Alzheimer's is going to require a multifaceted approach that engages both the public and the private sectors in taking action. Together with CDC and many other partners, including the Association for State and Territorial Health Officials, in 2013 we released a public health roadmap. And the purpose of the roadmap is really to outline specific steps that the state and local public health community can take to address cognitive functioning and cognitive impairment. It was it's grounded in a concept mapping process in which we engaged over 270 public health experts. And it's really designed to provide this flexible menu of actions with an ultimate goal of enhancing efforts to improve the health and safety and ultimate well-being of people living with Alzheimer's and other dementias and their caregivers, improve quality of life, and reduce risk for dementia at a population level. The roadmap is organized into four of the domains of the essential public health services, including monitor and evaluate, educate and empower, develop policy, mobilize partnerships, and assure a competent workforce. And of course, the curriculum flows out of that domain for assuring a competent workforce, in particular one of the action items, which is to develop and use introductory materials for public health professionals on cognition and the public health role. So from the roadmap, and a couple years later, we have developed and are really proud of and hope you will use our new curriculum. It's a public health approach to Alzheimer's and other dementias. It is competency-based and designed to increase understanding of Alzheimer's and other dementias as an important public health issue, and really to provide an easy way, free way for faculty to prepare undergraduates for careers in which they are going to need to apply public health approaches to address Alzheimer's disease as a multi-layered growing public health challenge. It is, again, intended to primarily be used in conjunction with undergraduate public health courses, and we're so fortunate to have it be developed by the Emory Centers for Training and Technical Assistance at Emory's Rollins School of Public Health, and again, to have CDC support. We did have an expert advisory group who contributed and advised us all along the way in developing the curriculum. And now I'm going to turn it over to Cheryl J from the Emory Centers to tell you more. Thank you.
Thanks so much, Molly. Good afternoon, everyone. As Molly said, my name is Cheryl J, and I am with the Emory Centers for Training and Technical Assistance here within the Rollins School of Public Health. Thank you so much for your time today. I'm so pleased to speak with you all about this curriculum. Thankful to the Healthy Aging Group at CDC as well as the Alzheimer's Association for their innovativeness in wanting to create what we think is a really useful resource specifically for schools and programs of public health. I'm here today. I get the privilege to speak with you all today, but certainly I cannot say that I am here on my own. I represent not only my colleagues, Dr. Linnell Blaze and Natalasia Swainson, and other colleagues here at Emory, but also the advisory board, which we had that informed the curriculum we'll be talking about today at other schools and universities around the country, and subject matter experts who lent their expertise and knowledge and time towards this. My role today and my comments to you all will be to talk about the curriculum, talk about a pilot that we conducted to help test the curriculum, and then talk a little bit about the enhancements that resulted from that curriculum pilot that we did. So as Molly mentioned, the goal of this curriculum was really to have a tool to increase awareness of Alzheimer's disease and dementia as a public health issue. Despite the prevalence and impact and the kind of daunting numbers that Molly presented a few minutes ago, this is not a topic that gets a lot of attention necessarily within our public health content and constructs that we have currently. So the goal of this curriculum was to really provide a tool that would increase the awareness, and then not only of Alzheimer's and dementia, but also the role that public health has in addressing these diseases, and to increase the topic among the future public health workforce. We need more people who are passionate about Alzheimer's and dementia going into this work and helping us move the needle and giving support to families and caregivers who are caring for loved ones who have this disease. So in developing the curriculum, we had a few assumptions. We knew that we wanted the audience to be undergraduate public health students. We wanted to focus on a resource that faculty and schools of programs of public health could use. It is introductory content for public health students to give them a broad overview of some of the topics surrounding Alzheimer's and dementia and the role of public health. The curriculum is divided into 4 modules that can be used together as one curriculum or meant to be standalone. Really the thing we wanted to do for faculty was make this as adaptable, as flexible, as easy to use as possible. So faculty would have a resource that was ready to use, easy to integrate into existing courses. We put really no parameters on how this curriculum could be modified in terms of taking out slides, adding in content, using some of the resources or not. So it's really adaptable to the time and the content needs of the faculty person. And then we wanted it to be competency-based. Again, the competency resources that we used are from these 5 organizations, And within each module, the competencies, there are specific competencies matched to the content of each module. So again, broadly, they represent these, but even within each module, you will look and see the different competencies and domains for each of these resources. To give you a brief overview of the module content, Module 1 talks about Alzheimer's disease as a public health crisis. It frames kind of some of the information that Molly shared earlier, the big picture, and tries to paint the picture of this really is a public health epidemic and why it's growing so rapidly and what impact that's going to have on the nation both now and going forward into the future, especially as we have a large aging population who's going to be needing resources and care and more at risk for these conditions. Module 2 goes into more detail about Alzheimer's disease and other dementias in terms of the physiology, talking about different symptoms, stages, risk factors. There are different types of dementias, goes in a little bit more depth about that, giving a kind of a nice broad understanding physiologically of what's going on with these conditions. Module 3 really focuses on the role of public health. And so this talks about, we focus on 3 public health tools, specifically surveillance, primary prevention, and early detection and diagnosis as the 3 tools that public health can use in terms of mitigating the Alzheimer's disease epidemic. And then Module 4 talks about public health and dementia-capable systems. So talking about the concept of dementia-capable systems and dementia-capable communities, which is coming into more of the forefront and nomenclature among dementia, people who work in the field of dementia in terms of what are we doing to help support people with dementia and their caregivers out in the communities. So within the curriculum itself, we set it up to have a faculty guide, which kind of guides faculty through. Each slide gives them talking points, gives more information, more background than is on the slides, learning activities that could be done in class or outside of class, sample test questions by each module that could be used either as a pop quiz or in more formal testing throughout the semester or quarter, the competencies used by module, PowerPoint slides, discussion questions, video resources, as well as case studies, and we also included citations for additional reading on the topic. So there's a lot more in a module than probably could be covered in one class, but it allows, again, the faculty member to adjust and pull in things and different opportunities that might focus on kind of where their content is going and where they want to direct in using this content within their courses. So once we had developed this curriculum last year, we wanted to pilot it and have an opportunity to see what it was like in the field and to make enhancements and to get really reactions and as faculty members presented it to their students. In a little while, I'll turn it over to Dr. Place and Dr. Dye to talk about their experiences as both of them were part of this curriculum pilot that we did earlier this year. Between March and July, we piloted the curriculum in 15 schools and universities with undergraduate public health programs, and we recruited faculty members. This is purely voluntary, those who had an interest, those who had time within their classes and a desire to incorporate some of this content. The purpose, again, was to assess the content in each module. Was it useful? Was the design of the curriculum as we had wanted, easy, flexible, adaptable? To get some feedback from faculty members to say, what worked well, what would work better, what in addition should we do, and then examine avenues for disseminating this curriculum to faculty teaching undergraduate public health courses within different schools and programs of public health. The revisions have been done, and I'll talk a little bit about that in a moment, and then the final release of the revised and enhanced curriculum is fall of 2016 pending. Anytime now in the next few weeks, we expect to have the curriculum through the compliance and completing the compliance process. So the pilot components, we sent the materials to the faculty, asked them to deliver one or more of the modules in class. We let them choose what fit best for the courses they were teaching. we asked the students in those classes to complete a pre-post test immediately following the curriculum delivery, again, to get some reactions from students. It was not designed to gauge knowledge gain, but more their perceptions. What did they maybe know about it going into it, but certainly what were their perceptions as they completed one of the modules and what their reflections were afterwards. Faculty completed an online faculty evaluation, and then we also did follow-up phone interviews, in-depth interviews with faculty members to, again, get more information about their experience and their perceptions and when they delivered the curriculum. To tell you a little bit more about the pilot participants, we had 25 faculty. We had over 1,000 students completing, seeing the different modules and completing the pre-post test. It represents 15 universities in 11 different states. So, and states, both coasts were represented and the Midwest, so we felt really good about the range we got. I wanted to share with you the course names, and so these were the names of the courses where the curriculum was piloted. Certainly we felt like it was a natural play for aging courses, that this would be a natural fit. However, we really wanted and encouraged faculty members to use it in other courses, and we were pleased to see these were the courses that they found relevance, and we certainly believe this has multiple implications and uses for different topics within public health, not just public health related to aging. This is a busy slide, but I did want to give thanks and recognition to the group of faculty, teaching assistants, and staff that piloted the curriculum. Again, you can see the representation of universities and also the varied nature of schools, but also positions which were held. We had teaching assistants, doctoral candidates, faculty members, lecturers, just a broad base of people interacting and using the curriculum. And certainly our gratitude and debt of thanks goes to these individuals for taking time to pilot this curriculum with their course within their courses. So teaching faculty, most of them had some personal experience with Alzheimer's disease or other dementias, and they rated themselves as having some knowledge. So that was important to us because these weren't experts. They weren't experts in the field of knowing about Alzheimer's disease and dementia, but most of them did have an experience of someone, a loved one, a family member, a close friend that had Alzheimer's or dementia, so they had an interest in that sense. 100% of them, which is you hardly ever see 100% of anything, reported being either extremely satisfied or somewhat satisfied in their experience teaching the curriculum, and 70% plan to teach the curriculum again and plan to broaden it out into other programs and encourage other faculty members within their schools to teach them as well. So that was very encouraging that we had positive responses and people were willing and wanting, found enough value in it that they're planning to do it again. So I'm going to share the next few slides are just some really high-level results from the pilot that we did. So this came from the faculty evaluation and talking about, again, the adaptability and the flexibility of this. We asked faculty members, was it easy for you to incorporate it into your existing course content? Did you feel it was well received by your students? You can see that 87% thought that it was easy for them to incorporate it into their existing content. 91% thought their students it was well received by their students. 87% thought that they were able to do it with the size of classes. We had class sizes from 10 to over 100 or more. So again, it worked regardless of the class size. And then did they feel it was important that it be included? And really nice to see that 99% or more felt like it was important to include in these courses as part of the content. From the student perspective, again, the students, majority of them were undergraduate, and nearly 60% also had friends or families that had been impacted by Alzheimer's and dementia. So again, while we think this is not talked about enough, it certainly does not mean that they're not experiencing this within their own lives or have some exposure to the magnitude of this disease in terms of how it impacts friends, families, caregivers, loved ones. The student's reaction, again, this is derived from the pre-post test that we did. The post test had additional questions that these are taken from. Was the content appropriate? Did they feel it was appropriate for undergraduate public health students? Could they see the connection between public health and Alzheimer's and dementia? That was really important for us, for them to be able to see the connection that, yes, this is a public health issue that we as public health professionals must take on and try to address. As a result of the content, were they more interested in learning about Alzheimer's and dementia? As a result, did they feel that they were more knowledgeable about it? Again, perception was that they did feel more knowledgeable, the information that was shared. And then we asked if they felt like dementia and Alzheimer's were issues that should be important and covered in undergraduate public health courses, and nearly 90% of the students also felt like this is an important topic. Some themes that emerged in terms of the value of the curriculum from students, they felt that the curriculum was certainly valuable in that it addressed Alzheimer's disease as a public health issue, that it was a good introduction to the topic. Faculty members felt this also was an important health topic, public health topic that should be covered. They cited the value of the curriculum from their perspective was that it was easy to use and easy to implement, and that it was a good resource. Again, I'll show some slides coming up that shows the talking points and the different resources, again, all designed so that they didn't have to go and become instant experts on it, that we gave them enough information that they could comfortably cover the content without having to do their own searching for additional information. From an administration standpoint, they felt that the value of the curriculum would be, again, it's public health focus, it's a comprehensive resource, but that it had the backing of CDC and Alzheimer's Association, and also that it was peer-reviewed, that we had looked at, that was approved by these national, well-recognized organizations. So that also gave it some validity and credibility above maybe some of the other publications that are created by various other organizations or companies, publishing houses. So out of the pilots came enhancements to the curriculum that I'm going to share here in a few slides. One is we redesigned the cover. And so as you'll see the display, the image on the front of the cover, initially it just had kind of your standard kind of Photoshop sort of picture of hands over hands to illustrate the caregiving role model. Well, we actually had an undergraduate public health student from the University of Georgia who developed this image here that's now on the cover, and it illustrates the growing impact of the disease, and it also impacts, and it might be kind of hard to see on this image, but the different types of populations that are impacted. It's not all older adults, it's not all white people or African American people, it's a variety of who it impacts. And if we even broadened it out further, it impacts a ripple effect among communities, families, organizations. So that was one of the first things we were proud to do, is to have a student who designed our cover art. The next thing we did, feedback, was we added the notes to the PowerPoint. So what you see in this slide, there are notes below it because faculty, while the faculty guide was helpful and had lots of talking points, when they got in class, they really wanted to have just the PowerPoint and to be able to speak from the PowerPoint and have the notes. As you'll also see down at the bottom, there's a video supplement. We would incorporate video supplement suggestions of videos they might want to show, short snippets of videos that would help, again, illustrate a point or drive home, in this particular one, what Alzheimer's disease looks like, a nice little TED talk about what Alzheimer's disease is. So we incorporated the notes within the PowerPoint slides. Talking points. This comes from the faculty guide, and you'll notice that there's a wider right margin. That's so that the presenter could write notes, faculty member could take notes, they could write questions, they could tie it in to other content to bring up and tie it in with other content in the course previously covered. And again, you can see it has the, in between the two bars is what is on the slide, and then the talking points expand upon what's on the slide, and then the citations are at the bottom of the faculty guide. And I'll also say that they're on the bottom of the PowerPoint slide as well. The citations are listed there as well. Student engagement options. Again, within the PowerPoint slides, there are discussion questions designed to illustrate a topic, to get conversation going around a particular topic. You'll see here, what are Medicare and Medicaid? What are the roles and responsibilities of the caregiver? Are the discussion questions listed here? Learning activities that could be done in class or outside of class, and then additional reading citations if you wanted to share that and encourage or make assignments to go further. Sample test questions, again, aligned with each module, has sample test questions and answers. Again, that these could be used within the course, could be used however the faculty member wanted to incorporate them into their class. One of the neat things we did is we developed some case studies. There are some phenomenal video resources out there, some programs, really well done videos that look at many different aspects and different perspectives on the disease, from both the patient perspective but also the caregiver, the health professional. And we decided to highlight a few of these and turn them into case studies. So here is an example of one case study. It comes from an NPR article done on Alzheimer's disease, undiagnosed or underdiagnosed in Indian country. We included the runtime so that faculty member would know how long it was, what the key terms were, and then what modules this case study might go well with the content of the module. And we gave a description as well as discussion questions, such that we gave a description that if a faculty member didn't have time to show the video or didn't have the availability with internet or access to be able to play either the audio or the video, that they still had enough information about this particular topic and to be able to answer the questions. So we included a description of it, as well as discussion questions that would generate conversation that could be done either in class or out of class, small group work within class. And that's included with each module. The other thing we did was we also included a list of video resources and gave the same type of information in terms of runtime, the link to find it, key terms, what modules you may want to show it with, knowing that we couldn't incorporate them necessarily into the content given the amount of time in class. We did want to provide these additional resources to be able to have faculty members either suggest to their students to watch this or to be able to show it in class. So the curriculum will actually be posted on the Alzheimer's Association website, and throughout this presentation you've seen the footer has actually listed the website where it will be housed. If you go to that website, what's currently there is the curriculum but not the enhanced version, and that's what we will be replacing the current curriculum there in the next couple of weeks with the enhanced version that includes the video resources and case studies and the revisions I just reviewed. But if you would like, the curriculum is there currently, the original curriculum. So at this point, I'd like to take a few minutes and have you hear from two faculty members who actually piloted the curriculum in their courses, Dr. Jean Marie Place and Dr. Cheryl J. Both piloted, Dr. Place piloted all 4 modules, and Dr. Dye piloted 3 of the 4 modules in her class, in their classes. And at this point, I'm going to turn it over to Jean Marie Place, Dr. Place, to share her thoughts on utilization of the curriculum and her perceptions as a faculty member using it in her class. Dr. Place.
Thank you so much, Tara. That's right. I piloted all 4 of these different modules in a class. It was called Applied Research and Writing in Public Health. So it wasn't typically an aging class, but I found it very useful in this class, and I'll tell you a little bit about how I used it in a class that maybe traditionally wouldn't necessarily discuss something like Alzheimer's and dementia. The first thing I want to mention, though, is that the students loved the curriculum. I taught in a class where there were about 25 students, and I received on the student evaluations at the end of the semester when students sort of comment on their reflections of the class, and I also had students comment to me personally that they really enjoyed this part of the class where we were discussing and doing these modules on Alzheimer's. Something that I perceived is that the students enjoyed it so much because it was different than the things that we typically discuss in public health. At least in my experience, we're often talking about obesity or diabetes, which are, of course, big problems in the United States, at least. But to talk about something that sort of isn't traditionally seen as a public health problem, like dementia, sort of just moved them. It just kind of opened up their minds, and I think it got them curious, and it wasn't just the same old talk about obesity. So I found them really curious about it. And the other thing that I would like to say about that is that students used words to me like they were fascinated with the curriculum, that they just really had no idea about this, that they didn't really know these statistics very much. And the way that it was presented, particularly with a public health lens, also really helped them. So in sum, to cover this point, I think that I want to really encourage using it in classes other than an aging class, because it's just a really unique way to look at public health principles in a topic that isn't typically discussed. And the second point that I want to say, based on my experience, is that the students were quite communicative. They discussed a lot when I brought up questions that were integrated as part of the curriculum. Surprisingly, to my delight, you know, they rose their hands and they had stuff to say, which is not always the case when I'm teaching these undergraduate students. So I felt like the questions were engaging, and I felt like it was something that they could relate to, which is interesting because these are 20-something students, but I think that a lot of them reflected on their grandparents, and maybe some of their grandparents had been experiencing this, or they knew someone. So there was almost this emotional tug to pay attention. And then in light of what I'm talking about, something that they really discussed a lot was Module 3. And the way that I presented this module, which is, the module is about different tools that public health can use to address Alzheimer's and dementia. And so I presented this module as saying, students, I want you to think if you were the director of public health in a county, and I want you to put on your public health caps and ask yourselves, where would you divert taxpayer money? Would you divert it to surveillance? Would you put it into primary prevention, or would you put it into early detection? And I think they liked thinking about, okay, what tool of public health do I think is going to be the most useful to address something like Alzheimer's? And it got them thinking in the public health lens, and I found that they enjoyed that activity, thinking about what tool they would personally use to attack this problem. And then the last thing that I want to mention is that I didn't find this curriculum hard to implement at all, and I don't have any experience in Alzheimer's or dementia. It's not the field that I personally work in. So I was a little bit worried. I thought, oh, I wonder if I got myself in over my head piloting a curriculum like this. But fortunately, it was very easy to use. I learned a lot. I became quite curious about the topic. I had fun with it. The talking points were very helpful, so I appreciated learning about these new revisions that Tara and her team has done, because it seems like it will facilitate teaching this curriculum even more. I also liked the idea of case studies, because I could see students sort of rallying around the different case studies as they consider situations in their own life, particularly with their grandparents and things like that. So I just would encourage you to use the curriculum. For me, it was a fun experience. I did all 4 modules. I actually did them out of order, and that worked too. So that's all from me.
Thank you so much, Dr. Place. I really appreciate your comments and your insights, and I love the way you morphed and used some of the content and came up with that great question about where would you do the funds and have them really think about a real-world situation. So thank you. Thank you for your insights. Dr. Dye, I'll turn it over to you now for your comments and reflections on the curriculum.
First of all, I'd like to build on a few things that Dr. Place said. I also found the curriculum to be very easy to use, and I have done research in this area, but I haven't organized all the information in a way to present to an undergraduate class. So I appreciated that that work had been done, and it was very well done as far as a sequence and the way it was presented, and I couldn't have done anything any better. It was just great. One of the tools that I found very useful were the videos. I used them as triggers for discussion at the beginning of the modules. I did modules 1, 2, and 3. And the first module, I started it out with the video about Alzheimer's, the long and costly goodbye. And then I used another video for Module 2, Inside the Brain, Unraveling the Mystery of Alzheimer's Disease. And then the 2 longer videos I did assign as for students to look at outside of class, and then for us to be able to discuss when we came back to class. My students had a similar response to the curriculum that Dr. Place described, and I was actually a bit surprised to find how many of them had a personal interest in learning more about Alzheimer's disease. I asked them how many of them had someone in their family or knew of someone, and almost every hand went up. So I think they could see just among themselves that this has become a public health epidemic. So they were vested to learn about this from a personal standpoint, and I think that the modules clearly make the case that this is a public health crisis and should be studied along with all the other chronic conditions that we've looked at throughout the years. So I would recommend this for someone who has a background in this content area or someone who does not. I think anyone could feel comfortable using this curriculum. I loved the curriculum to begin with, but I think the enhancements are going to make it even easier to use and make it even more organized as far as having the talking points right there with the slides and suggestions for where to insert the videos. So I can't really say too much more than what's been said, and I was glad to have the opportunity to be a part of pilot testing the project. The course I used it in was Health Promotion of the Aged, but I've already talked to our undergraduate curriculum coordinator and a couple of faculty in my department to make this a module, or at least one of the modules, hopefully more than one, to be a part of a core course that all 400 of our students would take called Introduction to Public Health, because I think every public health student needs to have this kind of background. And then as an added benefit, my doctoral student and I were developing a research proposal, and I was looking at this curriculum, and Module 4 actually helped us kind of organize our thinking about workforce development and becoming a dementia-capable system. So I thought that was a great summary of what we know about workforce needs and becoming dementia-capable, and so that was helpful to us putting together a research grant. So thank you again.
Thank you, Dr. Dye, and thank you again, Dr. Place, for sharing your comments and reflections. I know that as a faculty person that out there, I knew that your comments would mean as much as what I was presenting in terms of the use. So thank you so much for sharing that with your fellow faculty members who are listening today and encouraging them to potentially see how this content could fit within their courses or within their next research proposals. That's great to hear, Dr. Dye. I appreciate that. So thank you both. As we kind of turn to look what's next for this curriculum. So we've developed it, we've piloted it, we've made some enhancements that we feel will take what was good bones and make them even better in terms of its usability and accessibility for faculty. So where we are going next with this is on the road and disseminating it and doing things like this webinar today and encouraging faculty members like yourself to download the curriculum and see how you can use it within your courses in part or in whole. Again, it's designed to be used, and you can pick and choose and take the best slides and themes that fit with your content. We encourage you to do that, and we encourage you to share it with your colleagues beyond your department, within your school, and beyond colleagues in other universities. Again, regardless of what they're teaching, this is kind of a grassroots effort to spread the word about this curriculum, its availability. It is free. It is free to use. It is easy to download. And then it's also easy to incorporate. And it's been peer-reviewed and vetted and competency-based. And we've tried to put as many bells and whistles in it as we could possibly do and have it available and most likely to be used by you all. I wanted to mention one thing on the slide of requesting a flash drive. After this webinar, Sarah is going to send out an email to you all with the recorded webinar link and then also an opportunity. But as I mentioned earlier, the curriculum, the enhanced curriculum, is not live yet on the Alzheimer's Association website, but it will be in the next few weeks. But we would like to offer to send you all a flash drive with the preloaded curriculum, all the modules, all the PowerPoints, if that would be of interest. This is what we gave to our pilot participants so they could easily pop it in class or pop it in and look without having to go find it online. We certainly would like to draw you to the website to find it and download it, but we'd like to offer this as an additional thank you for your participation today, and an additional point to encourage you, a carrot to encourage you to start exploring this curriculum. So be on the lookout for that email and with information on how to contact us. My email address will be here in a couple of slides. You can email me directly or email Molly, and we will be happy to mail that out to you for your use and for your review. With that, I'm going to turn it back over to Molly for a last few closing comments.
Thanks so much, Tara. And we, since we are wrapping up, as you could tell, we do hope that you'll be typing in your questions and comments because we're really eager to find out what your thoughts are and be able to address any questions that you have about the curriculum. So as Tara said, we do have the curriculum on our Public Health Alzheimer's Resource Center online on our alz.org website, and the big red arrow shows where you can click to access the curriculum. The pilot version is up there, and we will soon have the final enhanced curriculum up and available. But we left the pilot up there so that you can, as you're planning your spring courses, you can take a quick preview, make your plans, get those submitted, and then when the curriculum becomes available in a week or two, you can either get your lovely purple thumb drive from us or be able to come back online to download. So we do encourage you to do that. And here are our email addresses and phone numbers. You can email us or call us anytime. There's no wrong door, and we really would love to hear from you. So thank you.
Wonderful. Thank you all for being here today. Molly, Tara, Cheryl, and Jean Marie. I think this webinar was very informative, and I know that there's a lot of requests for faculty resources, and I think this will be a great one. I wanted to remind everyone that this is now the time for questions. Please submit your questions via the question box, and we will address them as they come in. All right, so the first question, as the PI on a geriatric workforce enhancement project, I need to ask if we may use this content within interdisciplinary training activities on memory loss and dementia.
This is Tara. I will say yes. Molly, I'll let Molly weigh in too, but we would love the idea of interdisciplinary education. We know while we've intended this for undergraduate public health students, we know and have already received interest and questions from other disciplines such as nursing, social work, occupational and physical therapy, that the content is certainly applicable to multiple disciplines. So I'll let Molly, do you have anything to add to that?
No, but while the curriculum was designed specifically for undergraduate and public health to fill this kind of gap, we really would love to have it used in a lot of other interdisciplinary programs, and hope that you'll tell us about how it was used, and if there are any particular adaptations that we can make as we consider what we're going to be doing in the future with the curriculum. So thank you so much for your interest.
Wonderful, thank you. The next question, do you think it would be as easy to take a standalone webinar recording and develop a how-to for instructors to integrate it into their curriculum related to that topic? It seems like the packaging was a key aspect to this whole thing.
So Sarah, read that question again.
Sure, sorry. It
Okay.
says, do you think it would be as easy to take a standalone webinar recording and develop a how-to for instructors to integrate it into their curriculum related to that topic? Or it seems like the packaging is a key aspect of the curriculum. So
I think that if I'm understanding the question correctly, was it that could we do like a recorded webinar that says a little demo of the curriculum and say, here's how you would use it within the curriculum? There are tools that say, here's how to use this curriculum. Here's some steps. Here's some things to consider. So we could definitely consider doing a type of instructional webinar, a quick little tutorial, maybe like a little YouTube video or something on showing, similar to what we did today, but showing little aspects of how to use it, if I'm understanding the question correctly.
okay, maybe if the question is different, please ask again in different terms. Were there any questions asked in the evaluation about how much preparation time it took for faculty members in order to prepare the modules?
Yes, we did ask faculty members. Very good question. We did ask them how long it took to prepare to deliver the curriculum. I will say the average was about an hour to prepare. Again, that was to review the modules, to become comfortable with the content, to make any edits or to pull out slides or to add in other content to points they may want to incorporate. The average time was about an hour per module.
Wonderful. And then I missed it, but what is I know the modules are very flexible, but how long, if you were to use every piece of it, is one module intended to take? Is it one class? Is it several classes?
That's a great question. So the modules themselves were designed to be 60 to 90 minutes long, and they're Module 2 on Alzheimer's disease and other dementias, the basics, that's the longest module in terms of the number of slides and the content that is covered. And so the modules, the PowerPoints themselves, were designed to take 60 to 90 minutes. The other learning activities and videos, that's why we hesitated in incorporating a lot of videos as part of the content, was to give faculty members the time if they wanted to drop some slides to incorporate a video, or if they wanted to do there are discussion questions that are taken into consideration with that time frame, but some of the other student engagement, the case studies, those would up the amount of time, again, depending on how long you wanted to allot it. It was intended to try to come over in one class period, but again, if it's an hour versus an hour and a half, some of those things might factor into it. Yeah, it would be longer.
Sure, thank you. Next question. How can we link data from research and practice to the training programs in the field of aging health?
So how can you repeat the question, Sarah?
Sure. How can we link data from research or researchers and practice to the training programs in the field of aging health?
Maybe. You know what, I'd like to open that up to my other colleagues on the line and faculty members. Maybe Dr. Dye or Dr. Place might also have some thoughts on linking it. I think there is a lot of interest in research translation into practice, and so thoughts from our panelists. And Molly.
This is Cheryl J. At Clemson. Yes, I found Module 4 really did provide a great framework for making the case in a research proposal for workforce development, and gave us a guide to some of the ways to make a system more dementia capable. So I see that as a link to research and workforce development and how this curriculum can fit into that. I also would like to see this curriculum embedded in dementia-capable training for CNAs and long-term care facilities and in other venues like that.
And this is Molly. Alzheimer's, a public health response to Alzheimer's, with the roadmap, we drew heavily on what we know works for other chronic conditions. But there really is a great need, I think, not only for training different professionals out in the community in all sorts of different fields, but I do want to flag that there's a great need, too, for ongoing public health research on this topic. And at the Alzheimer's Association, we will be offering support scholarships for graduate level students this spring, trying to encourage more public health research and practice. But there really is a great need both for the workforce development, but then also for additional research, as well as trying and evaluating different interventions in the field.
Wonderful. Thank you. And then a comment from a participant that research is also needed on caregiver support services and surveillance of caregiver health, and I think no one can disagree with that statement. And then Molly, you mentioned the Healthy Brain Initiative's roadmap. What has been the reaction of the state and local public health departments to the roadmap?
Well, thanks. It's a great question. So when many of our chapters have gone knocking on the doors of state and local public health officials and talking to them about Alzheimer's as a public health issue and bringing the roadmap to discuss. And the first reaction tends to be surprise, or it's often like, oh, well, we always thought Alzheimer's was something that our aging department did, or sometimes that's something our mental health department does. But once they start learning the facts and looking at the growing burden and really thinking about it from a population health perspective, then the Healthy Brain Initiative makes a lot more sense. And I do say that, kind of once there's new awareness on the public health professionals' part, a lot of people do have or know someone in their community, often very close, in their close family and friend circle, who are dealing with the disease or have in the past. And so there's a lot of passion and interest in using the roadmap to do to start implementing and not necessarily stand up a whole new public health program, but really start integrating cognition and concern for caregivers into existing public health programs and services.
Wonderful. Well, as we are approaching 3 o'clock, I want to say thank you for all of our webinar participants for joining today, and thank you to our speakers, Molly French, Tara Red, Cheryl J, and Jean Marie Place. I want to remind everyone that this webinar is being recorded and will be made available on the ASPPH website at the link you see on your screen now. It will also be sent to you via email when the archived recording is live. And there are a few upcoming ASPPH ASPPH Presents webinars coming up that may be of interest. You can find those listed on the ASPPH events website to register and to learn more. And lastly, please mark your calendars for the ASPPH annual meeting and the Undergraduate Public Health and Global Health Education Summit to take place in March of 2017. Registration will be opening the week of December 12th. Thank you all again. This webinar is now adjourned.